Hi everyone, in this clip we're looking at lymphocytes, histiocytes and neutrophils. So neutrophils are present in virtually every specimen, and although they should normally be arranged in a single fashion, they often clump like this. But you can see the nice tri-lobed nuclei in most of the cells, and that's really the giveaway that you're dealing with leukocytes, with neutrophils. Histiocytes are also probably in most specimens, and they're smaller and probably more subtle. This is one here. It's got a sort of eccentrically placed nucleus and kind of foamy cytoplasm compared to the squamous cells around the place. So again, these are mostly single, but ThinPrep will artifactually clump them a little bit. Here's a little clump of small, actually quite small histiocytes. You see there's a neutrophil there, and they're around about the same size, a couple more down there. These are histiocytes. Another little clump of them here amongst some squamous cells. Again, they have sort of foamy cytoplasm. See that nucleus, which I'm bringing into focus, is probably renal shaped, kidney shaped or reniform. Histiocytes vary enormously in size, and this is an example of a multinucleate giant cell. So these are non-specific, but seen occasionally, especially in postmenopausal patients. Foamy cytoplasm again, and sort of a whole bunch of mirror image, so very similar nuclei are present in this. This is an example of lymphocytes. So you can see they have very little cytoplasm on them. The cells themselves are very round. They're fairly small compared to what I think is an intermediate nucleus above them. They vary in size, but they're all beautifully round in shape, and they are clumping together a little bit. There's probably a couple of neutrophils in that group as well, but most of the cells have a very round nucleus. I think those are neutrophils. These are lymphocytes. Difficult to see the cytoplasm on them, but you can see that one just has a little narrow rim of cytoplasm around the outside of it. This is another group, and again it's showing that same feature. So they're varying in size, which reflects the difference in maturity of the cells, but all of them have a very round nucleus, quite hyperchromatic, some of them, but they certainly are not growing together in a cohesive group. They just loosely clump together as an artifact of the ThinPrep preparation. So in summary, neutrophils are usually present. They're easy to identify because of the tri-lobed nuclei usually, and although they should be singly arranged, being white blood cells, they in fact sort of sometimes artifactually form three-dimensional clumps in ThinPreps. Histiocytes also are usually dispersed by nature, but they can loosely sort of clump together in ThinPreps. They typically have very foamy cytoplasm, sometimes with ingested material, and a very foamy, indistinct border compared to a squamous cell. Nucleus varies. It may be central, but often they're not. They're off-center, so that helps in separating them from squamous cells. And they tend to have quite fine chromatin, sometimes nucleoli, and you'll usually see in a group of 6 or so a kidney-shaped nucleus. Lymphocytes are rarely seen, so chronic lymphocytes is quite common in the cervix, but it's rarely sampled in a cervical sample because it's usually below the epithelium. However, in postmenopausal patients, we may sample them in particular and see them, and these should be arranged in a dispersed pattern, also being leukocytes, but again they can clump a little bit, as you've seen in the ThinPrep specimens. Often the nuclei are a bit hyperchromatic, and they have a very high NC ratio, being lymphocytes, even normally, but they always are uniformly round in shape. Occasionally there may be macrophages or histiocytes present with them that have little bodies in the cytoplasm. We'll talk more about those when we do lymph node cytology.